Hello, everyone. We are going to get started in just a minute or two. Give people just a second to join. Ooh, and I see those numbers jumping up. Well, we are very excited to be seeing you all today for this next installation in our quarterly Human Trafficking Prevention Project webinar series, which is put on in partnership with Maryland Volunteer Lawyer Service. My name is Heather Hyman. I'm the project manager of the HTPP here at MVLS, and I am joined today by Jessica Emerson, who is the director of the Human Trafficking Project, as well as our special guest presenter, Amelia Rubenstein, who's here from University of Maryland School of Social Work. I'm going to do a further introduction of Amelia, but I wanted to just do a few quick housekeeping notes before we begin. This webinar is being recorded and will be available on our MVLS HTPP website, which has a great resource library, including this and oh my gosh, not 5 years worth of past quarterly
I was going
webinars.
to say, don't
So
sell us that short.
yeah, there is a lot for you to peruse. We will be monitoring the chat, but we would encourage you to use the Q&A to put questions throughout the presentation that you'd like to ask Amelia. We'll be monitoring both, but the Q&A helps us keep track of the questions that are coming in. We will be sending out a PDF of this as well post the webinar. But now let me turn to welcoming our guest. Amelia is MSW LCSW C. I don't even know what that all stands for because I am not a social worker, unlike the both of you. She is the director of the Prevention of Adolescent Risk Initiative, so known as PARI, at the University of Maryland School of Social Work, where she leads programs to advance the health and safety of Maryland youth and their families. As a clinical social worker, researcher, and nonprofit leader, she has worked with survivors of sex and labor trafficking for over a decade to build systemic responses to exploitation. She's also an adjunct professor at University of Maryland School of Social Work. So if you are a student there, you should take class with her. She has frequently served as an expert witness for cases involving human trafficking, sexual assault, and other types of victimizations. She co-founded the anti-trafficking program at Turnaround, which provides wraparound services to survivors of human trafficking, and received her bachelor's of social work degree from Skidmore College and master's of social work from Columbia University. And Amelia, we are so excited to have you here to discuss this really important topic. I know, Jess, you'd wanted to say a few words before Amelia dives in about why we selected this and why it's so critical, especially now.
Yes. So, hi, everyone. Thank you again for joining us, and thanks to Amelia for joining us. As you know, it is Human Trafficking Awareness Month, and we wanted to do a webinar during Human Trafficking Awareness Month, but quite honestly, we've covered a lot in these webinars over the past couple of years. And I think I was having, probably my millionth discussion with someone about how I had heard a bad human trafficking statistic. And we were just kind of chatting in one of our partnership meetings. And we were like, we've never actually put on anything to talk about human trafficking statistics and how to be more purposeful and more accurate in the information that we present. Amelia, I don't remember when you got involved in the work, but I got involved in probably 01 or 02, and we were throwing anything and everything out there to see if it stuck. And, I think and I know you're going to get into this, but we didn't learn lessons from people who had done it before. And I think that we are, to this day in 2024, still challenged by essentially the myths that we put out there as fact in the early days of the work. And so, as anyone who has been around, me in this work here in Maryland, talking about human trafficking statistics and making sure that we are accurate in the work that we do and the work that we portray is something that's incredibly important to us and to the HTPP. So I am so excited to hear what you have to say, Amelia. Thank you so much for being willing to present on this.
Of course. Thank you for having me. So as Jess said, I'm Amelia Rubenstein. I'm very excited to be here today. Talking about research and data in human trafficking is an area that I'm very excited about. So I'm just going to dive right in. So I'm hoping today we can kind of take away three main points or three areas of learning. So first of all, importance of data. Why is high quality data in human trafficking important? Why is it so hard to find? Data credibility. So how are we evaluating the data that we do have on human trafficking? Are the stats that we're using, are they accurate? Are they credible? What makes something credible? And then some tips for improving. So how can we do better with accuracy? What can you do in your own work? And hopefully I have a couple hands-on tips that you can use. So in diving in, this kind of stood out to me. So I don't know if people have followed some of the kind of viral stories on social media and sometimes on news websites where QAnon theories kind of exploded, and a lot of them had to do with trafficking. So this is an example from the Washington Post about a story about how a QAnon conspiracy theory that Wayfair was sex trafficking kids turned into an internet mob. They actually ended up hurting the victim. They derailed the trafficking investigation that was taking place and kind of incited other violence. This also happened with Pizzagate, where a man was convinced that children were being trafficked in a pizza restaurant in DC and showed up there with a gun. So some pretty recent examples of how things are kind of going off the rails and what can happen when we don't have good data. So
And
I want to
Amelia, just
yeah.
as far as that Wayfair story, I also remember I heard from a trafficking survivor leader in the movement, who I'm not going to name, but who was going on to these message boards and things like that. And the people who were spreading this conspiracy theory were attacking the survivors who were saying, no, that's not really what it's happening, and blah, blah, blah. And they were being told they didn't know what they were talking about.
Yeah,
I just thought that was astounding.
I remember I was living in DC when the Pizzagate situation. I had friends, when that happened, and I mean the individual that came down there actually shot a weapon through the floor. I mean this ended up in a situation of real violence, and that could have been a much more tragic situation than it already was. And so I think this is particularly timely, given the discourses that are going on in our country right now, that we're sure we're using with the right statistics as much as we can.
And that man was absolutely certain that he was going to rescue a child that was being held against her will. So I want to take a step back for a second and take some lessons learned from a different issue. And so I have a couple minutes on this. So it may seem like I'm going on a tangent, but it does all connect back. So I wanted to look at the beginning of the HIV and AIDS crisis. The woman that you see here is named Elizabeth Pisani. She's a famous journalist who turned AIDS researcher. She's a public health expert. She's very well respected in the field of HIV and AIDS. So her story is that Pisani starts hearing about HIV and AIDS in the early 80s. By 1985, every single region in the world has reported at least one case of HIV. At this time, there is a ton of misunderstanding about the disease. People don't understand how it's transmitted. They're very scared. The media doesn't handle it very well, so people start seeing some really scary headlines. Does this sound familiar to anyone? So in 1996, Pisani starts working at UN AIDS, which is the UN agency that acts as an international clearinghouse and is supposed to give kind of official statistics for HIV infections. So in the mid-90s, her and these researchers at UN AIDS they didn't know a lot about the HIV epidemic, but they were fairly certain that they knew that the largest majority of people who contracted HIV got their infection while having anal or vaginal sex or through injecting drugs and sharing needles. So there were other modes of transmission of HIV. There's blood transfusions and mother to infant, but those make up a very, very small percentage of how people contracted HIV. So internally at UNAIDS, the researchers see that it's clear that HIV is not going to affect all populations the same. It's not going to rip through the kind of general population, general public, but it's specifically going to burden men who have sex with men, people involved in the commercial sex industry, and people who inject drugs. And we know how governments tend to treat and value those particular groups. So as you can see, the disease is becoming more stigmatized. So Pisani and her colleagues, they watch as HIV/AIDS continues to hit certain countries and certain populations very hard with really devastating effects, especially because this is before there was effective treatment. So at the time, HIV was essentially a death sentence. So governments of poorer countries are closing their eyes to the early signs of the AIDS epidemic. And even if they did want to help, there's no money or resources. A lot of these are developing countries that have very little public health infrastructure. So Pisani and her colleagues decide that the first thing they really need to do is get a lot of money for HIV prevention. And this is going to mean convincing rich countries, developed countries, that they should care about HIV and AIDS in poorer countries. And how are they were going to do this? They were going to do this by making them feel this kind of heat of an impending epidemic that's going to affect everyone. And they're painting a picture, a pretty compelling picture of devastation that HIV leaves. And I want to make a note that Pisani and these researchers, these are people like us. They were true advocates. They were acting in good faith. They desperately cared about the lives of the people that were living with HIV and AIDS, and they really wanted to help. So they start sharing their statistics. For example, they say the new cumulative cases increased by 19% between 1995 and 1996. They share some other stats, but these are kind of like failing to inspire government leaders and the people who hold the purse strings. They knew that HIV wasn't going to impact the general public anywhere near as much as it was going to impact men who have sex with men, people involved in commercial sex, and injection drug users. But they also knew that governments don't like to draw attention to or spend money on those particular groups. So Pisani and her colleagues had to kind of beat things up a bit. She says they absolutely did not make up stats, but they skewed the numbers to make it look like HIV would impact the general population more than it actually would. They made it look like it would impact people that politicians do care about: heterosexual wives, children, infants. And while they didn't make anything up, they took results from small studies with unrepresentative samples, and they presented the numbers in the worst light. She says, we were pretty certain that neither donors nor governments would care about HIV unless we could show it threatened the general population. We needed them to care if we were going to get more money, and we needed more money to pay for better prevention. So by 1998, they are successful. They've caught the attention of the World Bank. The US National Intelligence Council declares HIV a threat to national security. So funding goes from 300 million in 96, this is kind of world funding, to 10 billion in 2007. There's just this enormous influx of resources and money. And you can probably see where this is going. So the lack of following facts and instead following ideology, misconstrued data, ends up with some pretty horribly wasted money and resources spent where they weren't needed, and no resources where they desperately were needed. So one of the worst examples that Pisani kind of owns up to, because she was part of this, is that they East Timor, which is a very small country, got multi-millions of dollars from USAID. And at the time, they had 7 people who had ever tested positive for HIV in that country. So they were talking about basically $300,000 per person that could only be used for HIV and AIDS. And this is at a time where people in East Timor were really struggling with lots of other diseases: diphtheria, maternal mortality, other things. And injection drug users in other countries have none of that money. And so I really see a lot of parallels where things can go off the rails if we draw attention in the wrong way, and if we're not accurate about what's really needed, who's being impacted, and if we fail to follow the facts and instead kind of follow narratives that we think sound good. Anything to add, Jess?
So I didn't know the fact about the East Timor money, but what I'm immediately thinking is, so they skew. I think first of all, it's important to point out they had good intentions going in, but we also know that, if I step on your foot and I didn't intend to hurt you, it doesn't mean your foot still doesn't hurt. And you mentioned very clearly that men who have sex with men, people who trade sex, and injection drug users are the three populations who are hardest hit. And one of the things that came out of this boom of money, or boon of money, whatever the word is the anti-prostitution pledge, right? And so with all of this money, right, you couldn't actually use any of the HIV money to serve people who were trading sex or support any kind of decriminalization efforts at that time. And so just the irony of that piece was just sizzling in my brain. So it's like we do the thing and we know the facts, but then we actually block one of the main populations who are impacted from having money spent on them.
Yep. And my favorite, I love this quote here. It's in like a little visual here, but this comes from the National Resource Council and Institute of Medicine, a 2013 report that is, I think, 300 or 400 pages. It's very extensive. And everybody is always very interested in prevalence, how many people experience trafficking. And I love that they say that the estimates range from 1,400 to 2.4 million. And that is what it is. You can find studies that have both of those numbers and everything in between. And so there is no true estimate of these crimes in the United States. And I think we just have to kind of be okay with that in certain ways. We know there's a lot of challenges to data reporting. I think everybody who is on this call probably knows the individual level factors. Victims don't want to self-identify. They may not know that what's happening to them is a crime. There's fear of repercussion from law enforcement, fear of retaliation from traffickers. Kids have been told that they're going to be put in out-of-home placement. I mean, people have a lot of different fears, but we also have a lot of silos. So, victim services agencies, they keep their own data. Law enforcement keeps their data. Prosecutors have another kind of set of data. We have, how many people were prosecuted on human trafficking, how many were convicted. There's differences in definitions of trafficking across states. And so there's problems with all of these, kind of aggregating all of these data sets, and then particularly VOCA and VAWA confidentiality laws, which I think are hugely important, and I'm not arguing against them, but they do put limits on information sharing of identifying information. So it's pretty hard to, even among a group of service providers, say, okay, well, you each report that you serve 10 clients and there's 10 of you, but we can't really say that that's 100 victims because you guys might have served the same people. And because we're not sharing identifying information, rightly so, we're not going to be able to ensure that those are individual, discrete people. So when I look at research on trafficking, I see kind of three main types of research. Data on victim demographics tends to be a really important one. So this area refers to helping us get understanding about who's being victimized and how often people are experiencing trafficking. One of the most sought after data points is prevalence. People want to know how often this happens. So prevalence is often used in a medical or public health research setting, and it refers to the number of quote unquote disease cases in a particular population at any given time. So for prevalence in human trafficking means knowing how many people experience trafficking in a certain population. For example, how many men were trafficked in the US from 2000 to 2010? That's a question asking for prevalence. So why is this important? Primary prevalence tells us how big the problem is and therefore how much attention and resources we should commit to it. Secondly, estimating the number of people experiencing trafficking helps plan our programming, since we use that information to guess how many clients to plan for example, how many shelter beds are needed, how many therapists to include in a program to serve survivors. And the same is true for research on other aspects of victim identity or victim demographics. Research asking at what age are victims first trafficked, or what is the racial ethnic makeup of victims, or how many identified survivors had involvement in the child welfare system prior to being trafficked. All of those questions and getting the answers to those help us plan effective and responsive programs. For example, if 90% of identified victims in an area are Spanish speaking, a program is going to know that they need to hire primarily bilingual staff. It can also help us identify other problems. So let's say we have 60% of identified female trafficking victims in a county. And so 60% of them are people of color. Even though people of color only make up 30% of the county's population, we can look and say we're really seeing a disproportionate number of people of color affected by trafficking. Second area tends to be intervention efficacy. So there are many different ways that we try to prevent, identify, and respond to victims of trafficking. And all of these efforts you could classify as interventions. It's anything that we do to try to respond to trafficking. So examples of interventions could be an agency that starts using trauma-focused cognitive behavioral therapy modality during therapy with survivors of trafficking who are trying to lessen trauma symptoms. An intervention could be a school system that implements a human trafficking training curriculum for teachers and students in the hope of preventing students from being trafficked. But before we use an intervention, we should absolutely know that it works. Therapeutic modalities should have studies that show impact on victims and evidence that they reduce trauma. For training curriculum, we should only use it if we have evaluations showing that the training results in people having either increased knowledge, awareness of trafficking, and or skills to then go on and respond to trafficking. If we use interventions that don't have evidence that they work, we risk wasting our precious time and resources, and at worst, actually perpetuating harm. And I'm guilty of this. It can be really easy to think that something is working because either the staff feel good about it or they enjoy it, or because one client or some clients say, hey, this really helped me. But interventions, you really need formal and thorough evaluation to ensure that they're giving the kind of results that we're searching for. A colleague that's actually on the Montgomery County Human Trafficking Task Force is a researcher who's worked a lot in juvenile justice, and she talks about a program that they set up on the Eastern Shore. It was kind of a diversion court kind of thing with extra support services for the kids involved in that court. And she said the reviews from the family and the staff were all fantastic. But when they looked at the actual outcomes, they had spent $500,000 on this program and nothing had changed. Nothing had changed about recidivism or the kids' health outcome. I mean, nothing had changed. So even if something feels good, it doesn't mean that it necessarily is working. And evaluation interventions mean knowing how to measure outputs versus outcomes. And I want to be really clear about this, especially for anyone who's working in a service program setting. If you want to measure your work, you need to split up what you're measuring between your outputs. Your outputs are your activities. So case management sessions, therapy sessions, transportation vouchers. How many cases did an immigration attorney work on? How much time did advocates spend with a survivor in court last week? Those outputs tell us about the work that we're doing, how much we're doing, our activities. Outputs are not the same as outcomes. Outcomes are different. They measure the impact of the outputs. So while measuring the time that an advocate spends with a survivor is important to know your program activities, what's critical is knowing the outcome of that time. How did that time the advocate spent with the survivor in court impact the survivor? Was the survivor's anxiety decreased? Was the disposition of her court hearing better because she felt calmer, more supported, and then was able to participate in the hearing more effectively? It's easy to identify. It's easier for us to say which outcomes we're seeking. We want fewer people to be victimized through trafficking and survivors to experience less trauma daily. They're extremely hard to measure. And this could be a whole other webinar. But if you are a provider and you're having trouble with outputs versus outcomes, there definitely is some kind of nonprofit technical assistance to help you look into program evaluation so you can see a little bit better what impact you're having. But I will say it's constantly the most challenging part of any program that I've worked in. Um, so the third area of kind of trafficking research is policy analysis. I see this a lot especially in our local task forces where people really want to pass some legislation. And I think the impulse behind that is good. We want to do something, but sometimes it's picked without really knowing like what we want to do, or that the thing we say we're going to do is going to have any impact on trafficking. So examples of policy interventions could be a state passing a new law defining and criminalizing labor trafficking. Yay, we did that. A county that creates a human trafficking task force through legislation, or an agency that sets a new eligibility policy for emergency shelter referrals. Those are all policies. But we need to have evidence that the policies worked in similar settings or with a similar population. If we implement policies without any background knowledge, we definitely can see harmful unintended consequences in that. So for example, some people are very interested in kind of cracking down on massage parlors or making sure there's more licensing or those kind of things. But how do we know that that's actually going to prevent, intervene with trafficking at all? It could have the unintended consequence of criminalizing women who are undocumented or may not have access to other industries that they can work in.
And I just want to interrupt and let you all know there's so much good information in here. We are going to have a tip sheet that captures all of this. So don't feel like you need to be because if I didn't know that, I'd be taking notes right now. And you do not need to. We'll capture this information and the additional stuff, and it'll all be available for free on the HTPP and MVLS at HTPP websites.
Amelia, this is so timely given the legislative session here in Maryland has started. You know what I mean? There's always kind of a proliferation of bills where people have very good intentions, you know, trying to address this particular issue in the state. And I appreciate your breakdown, like, you know, both looking at how we could quantify this issue, but then also talking about within programs, like how are we tracking things, you know, the outputs versus outcomes, like how can we show things are effective? It's really needed when we're also thinking about then turning our data, internal data, into something that can either support or push back on policy change.
Mm-hmm. Yeah, absolutely. And policy analysis is hard to measure, but one of the best ways, and I like this because it has very easily quantifiable numbers, are cost benefit analysis. So this is a method of assessing kind of economic efficacy or impact of a policy. It's a really cost benefit analysis is a really careful accounting of all of the costs of a policy versus all of the benefits. So the benefits could be money saved, productivity gains, monetized value of health improvements, you know, ER visits, that kind of thing. Minnesota did a really cool cost benefit analysis on their regional navigator no wrong door approach that showed that it really actually saved money overall because they were intervening with kids early on. And that was a big way that they were able to get that program passed through the legislature and get continued funding for it, is because they showed that it had an overall net benefit.
Yeah, we see that a lot in criminal legal reform work. It's that cost benefit analysis. I will admit that it makes me uncomfortable, you know, to cost benefit analyze a human's life. But at the same time, there's very concrete cost benefit analysis data that says that incarcerating people costs far more than providing them with the things that they need to survive in their day-to-day lives and rehabilitation and things like that. So it can be incredibly effective data.
Absolutely. And I think people who are really good at cost benefit analysis are good at taking things that are very hard to measure, or, you know, the value of someone's life, and we can't really put a price on that, but trying to find out a way to represent that in a cost benefit analysis. All right, so we understand why data is important, kind of what types of research we're looking for and looking at. So I want to jump into data credibility and some of the very frequent stats that we use. I will say that a lot of the ones that I took here to kind of pick apart and rate do have to do with child sex trafficking. And I'll say that that's happening for two reasons. One, it's the area that I worked in for a long time. Although now I try to kind of work in both labor and sex trafficking with adults and children. But also, I think it's the area where some of the most egregious data errors have showed up, because there's something about child sex trafficking that just grabs people's attention, sometimes their imagination as well. And so I'm going to go through a couple of those. So I want to show you, many of you have probably already seen this video. I'm not going to show the whole thing. I'm just going to show you a couple minutes, and I'm going to pause at a specific place. But I want to say that the video is called The Making of a Girl. It was put out by GEMS, which is one of the first organizations in the US. It's in New York City, that focused on trafficking victims who were US citizens. Jess knows them very well. She used to work there. And I want to say I love this video. I show it at many different trainings. I love it. I think it's high quality. I think it gets its point across well, but I'm going to pause at one of the more problematic parts.
You know, you're 12 years old and you're living with your moms, and your mom's is struggling because she didn't think that life was really going to work out like this for her, and she doesn't have a man around, and the men that are around haven't always been that great. Sexual abuse is becoming kind of normal for you, and you think that other people don't have secrets that are as bad as you, and maybe you've tried to talk to somebody at school and they haven't really heard you, or maybe they just haven't had time to listen to you. And so you're seeing these girls on the videos, and they're so pretty and they're so sexy, and so your way at 12 of escaping into this fantasy world is to think about what it must be like to be one of these girls, and you know that adult men already look at you, and you wonder how you can kind of use that.
I was just a child, and that's how I was supposed to live, like a child, like an adult.
So one day you're coming out of school and there's a guy outside in a Cadillac, and he's nice looking. I mean, he's got the baseball cap and the jeans and the Timbs, and he tells you how pretty you are, and you know how pretty your hair looks, and it's been a while since anybody even really noticed anything about you. And for the first time, you feel like somebody's really interested in you, because now all of a sudden he's asking you about your dreams and your hopes and where your father's at, and he says that he can be a daddy to you.
The people that I shouldn't have depended on, I was depending on for support.
Okay, here we are. We're at our spot. So this video is interspersed with a couple different stats. So this one says every year more than 300 children become victims of sexual exploitation. So we're saying every year 300,000 kids are sexually exploited. First issue here, there's no citation. You have no idea where this source came from. I want to say that this video, this specific link, has over 200,000 views. So many people have seen this link, and there's several links where you can see it. So this video has a big reach. So lots of people are getting this kind of quote unquote factoid. And this has been one that's been really problematic. I see it on a lot of different websites, often saying 100,000 to 300,000 kids are trafficked every year. That's just simply not true. I'll take you through kind of where that came from. And the first issue is that estimate, this is completely phrased in the wrong way. The initial phrasing was not that they became victims of trafficking, but that they were at risk, which is a huge difference. The number of people at risk for something and the number of people who actually have that thing happen is very different. So let's get rid of the became sexually exploited in a year. That didn't happen. The original research made that an estimate. And you can see over here that these are representatives. These are our congressmen and women who are sharing this stat at congressional hearings, at public forums. So they're sharing this with a wide audience. Sometimes they're attributing it to the Justice Department. Sometimes they're adding in their own things, like that it was mostly young girls at risk for this. So this statement has a lot of reach. So let's first take a second and think about this. So let's say we took the middle part here. 200,000 kids become victims of trafficking every year. Let's say that that's actually true. If we divide that up by 50 states, that means that we would be talking about seeing 2,000 to 6,000 kids every year in every single state. And I can tell you in Maryland, over the past 10 years, we've had 1,000 screened in reports. So you can start to see now that like those numbers are not really adding up. Even though we know we're never going to see every case out there, but that kind of starting to tell us that that might not be accurate. So where this came from is this study that came out in 2001. It was written by Estes and Weiner at the University of Pennsylvania, which is a school of social work, which is a very reputable university. And first of all, the study came out in 2001, and it relied on data from the early 1990s. So now we're looking at several decades ago. And the report suggested that about 326,000 were, and this is a quote, at risk for commercial sexual exploitation. So I just want to confirm again that they never said in the research that these were kids who were actually victimized. These were kids who were at risk.
And Amelia, just for folks who are interested in the report, it literally underlines at risk in the report. That was always ironic to me. Like, I know that there are a lot of problems with this, and the authors have said, I mean, I don't know the details like you do, but that even the authors are like, yeah, don't cite this, but they had the forethought enough to underline at risk.
And they've interviewed at least Richard Estes, who said that this study has been so misconstrued that they wish they had handled it differently in terms of presenting the information. I also want to now dig into the 326,000 children at risk. One of the problems with this is that they began by compiling, and first of all, this is US, Canada, and Mexico. So we're talking about 3 very large countries. They began by compiling the number of youth in 14 different risk categories. So those included unaccompanied foreign children, kids living in public housing, or female gang members. Those were kind of 3 of the risk categories that they had. But many of those categories can overlap. You could have a female foreign-born child living in public housing who was part of a gang. Using their methodology, that one person would then count as 3. So it already is a pretty inflated number. It was also relied on a series of guesses that the researchers made about the assumption of what percentage of runaways were at risk for trafficking or had been trafficked. And the researchers really were careful to include many caveats. If you read the entire study, as Jess says, they say that this is a difficult figure and that it shouldn't be, construed as a hard fact. And of course, all of these caveats were completely ignored in the public discourse. Nobody listened to that. So in 2008, there was 2 researchers at the Crimes Against Children Research Center, which is very respected. It's at the University of New Hampshire. They wrote a report about this report. And in capitals, they say, please do not cite these numbers. The report pleaded. The reality is that we do not currently know how many juveniles are involved in prostitution. Scientifically credible estimates simply do not exist. So, yeah, there you are on that one. So
that's not a very good soundbite, though.
No, it's a terrible soundbite. It's a terrible one. And nobody wants to go to a training and say, like, let me tell you about this issue that's really important to me. Also, we don't know anything about it. It just doesn't have the same.
And it's not, and it's really bad at capturing the attention of people in power. I mean, for what it's worth, I'm thinking about Representative Wagner. This was a 2001 study. Obviously, she learned about it somewhere in the 2000s, was still talking about it in 2015, but then this grabbed her interest. And she, to this day, co-sponsors bills. I think she was the last co-sponsor on the Trafficking Victims Relief Act for federal vacatur. So it is definitely a double-edged sword. Like, you're right, it doesn't sound good in a training and it doesn't get anyone's attention.
And now too, I feel like with social media, people are looking for tighter and tighter, you know what I mean? Like bits of data they can grab. And then it sounds like it's just more and more of a risk, right?
So it's just getting worse is what you're
Yeah.
saying. When I celebrate Festivus every year. We do an airing of the grievances, as is common. And my airing of the grievance, my serious one, was social media activism and soundbiting. Honestly, that was the thing that I said I think is going to take us down as a nation.
Yeah.
And so it's bad that we had this before we had social media, and now it's even worse. And I just have to tell you, thank you for showing that video just warms my heart, because I know it has its challenges, but that's the world that I started out in 2003, 2004. Those kids were my kids. I've been in every inch of that video at one point or another. So it's nice to see. I stopped using it for the reasons that you are going over, but it is still nice to see kind of where I came.
And I would say people can still use it. I still use it. And I give a caveat that I think this material is great. It's such a good representation of what happens.
It is.
They have some really old stats in there. Please ignore them. They're not true.
Yeah.
And then I say that again after I showed it. So, and I want to compare. So this is what we're giving out in terms of trafficking. But when we look at, so this kind of lack of credible stats for child trafficking is really noteworthy. If you look at other threats to children, the other types of violence and things that can really cause harm to them, gun violence, car crashes, sexual abuse, there are some very, very good, firm, consistent statistics. There are, 3,000 deaths per year of a certain age of kids for gun violence, 4,000 deaths per year for car crashes. 1 in 9 girls and 1 in 53 boys will be sexually abused. And that's a more tight, accurate statement. So in other forms of violence and harm against children, we do have a little bit better of a picture. So this is all very frustrating. And what do we know? What can we say? And what I would say is try to share stats that are a little bit closer to home or smaller populations. So for example, the Human Trafficking Institute reported federal authorities initiated 145 cases of trafficking in 2019, and 88 of those involved children. Something like that is small. You're reporting on something that actually happened. According to Texas Christian University, that keeps a database of every trafficking case in the country, federal prosecutors took on a total of 642 cases involving sex trafficking of minors over a 15-year period, and averaged about 43 a year. That's a very good stat we can use. It's specific. It tells you how it's being measured. That's why I like court stats that have to do with the criminal justice process, because the definitions for those things are similar, although there's still problems there, right? Because we know that every every trafficking case does not get prosecuted as a trafficking case. If it's prosecuted as something else, but it really was trafficking, it's not going to show up in our numbers. So
certain clients, another challenge with that video is that it only portrays one type of trafficking, right? I mean, that's one of my criticisms in the training world, is that if all we are talking about, we're training law enforcement, we're training service providers to recognize and understand quote unquote pimp controlled trafficking, then you are not scratching the surface of what else is out there. And that is what gets portrayed on television shows. That is what potential jurors in cases see. That's what judges see. That's what prosecutors see. And so even using the court statistics, we have to ask, I agree using them as data, 100%, but I think we need to take it a step further and say who is being identified and why. right? So but that's not a data issue. At least I don't think so.
Well, and even in things like, if people are familiar with the yearly FBI Operation Cross Country that focuses on child trafficking, they will often, the FBI will report they'll say like how many people were recovered or how many children were recovered, and sometimes they're including people in there that were not trafficking victims. Sometimes they were people that hadn't been trafficked, but they were friends of, they were in the wrong place. Sometimes they were adults who are consenting and involved in sex work, and they're all being categorized in the same kind of lump group. So that it's even problematic sometimes with law enforcement statistics.
And the same is true for the people that they say are traffickers, right? It's people that they might arrest for trafficking or for patronizing. And it's really problematic to paint it as anything other than it is.
So my second area of concern with the video, and this is another one, so the average age of entry into prostitution is 12 years old. So you can see why this would grab people's attention and be very alarming. That's a horrifying idea. But I want us to just from a very basic math standpoint, if we're talking about average, this would mean that just as many 9-year-olds entered prostitution at the age of 9 as did kids that were 15. And we simply know that that's not true. Where I've done work with hundreds of trafficking victims, I have had a few that were trafficked under the age of 10, but it is nowhere close to the number of kids that were trafficked in their early adolescence, late adolescence. So first of all, the math you can tell already is that doesn't make any sense. And we're missing context. What's the sample size? Where did this info come from? Is this in the US? Is it other countries? Is it men? Is it women? The Washington Post looked into this because it was also being shared by some of our congressmen and women, and they gave it I have an animation here, a 4 Pinocchio rating, which is their worst rating for little factoids that are wrong. And you can try to trace where this came from and down a million rabbit holes. Some people said they got it from the FBI or the DOJ. Some people said it came from that Estes and Weiner study where they did have a smaller sample size of 100 kids that they asked when they were trafficked. But that was only looking at kids. If you only look at kids, your average age is going to be lower than if you're looking at everyone who entered into prostitution. So let's just toss this one out. I think it's better for our brains not to even try to figure out where this came. I mean, you can try, but you won't get a great answer. And let me give you a better example. So let's look at, this is a very recent study that came out. It was done in Baltimore, and it was published in the Journal of Urban Health. And it was not about age of entry, but they did ask their sample size, which was 250 cisgender women, when they first sold sex, is how they defined it. And the average age of entry was 24.7. I'm not saying that that's going to be true across the board, but at least we can say like that was true for this specific area. It's local to Baltimore. You can talk about it. And there's a couple really good things that I like about this. I say high sample size because it was an N of 250, which in social sciences research actually is pretty good, but I should say medium sample size. When you look at like the samples that they did for the ACE studies, for like the Kaiser ones, you're talking about, tens of thousands of people. So in the grand scheme of things, not a huge sample size, but in social science research with vulnerable populations, that's actually pretty decent. It's recent, came out in 2020, and it's peer reviewed, and it was published in a very respected journal, the Journal of Urban Health. So this came out of some researchers from Hopkins.
For those of us who are not researchers that are listening in, can you explain peer reviewed?
Sure. So a peer reviewed, let's say you want to submit like an opinion article somewhere to a local paper. You send it in. If the editor likes it, they'll publish it. It's just one person that is looking at it. A peer-reviewed study is one that is submitted and it's reviewed by people who have the same credentials that you do. So, PhDs, people who are researchers, and they're really going to dive into your methodology, your sample size, They want to see your data. And I've gone through the peer review process several times, and it is brutal. They will come back with lots of questions because journals don't want to publish something that they'll then have to do a retraction for. So if it's a peer-reviewed article, it means that it's been through many layers and has been looked at by people by other academics who have knowledge in high quality methodologies.
So it's insurance. It's research. Yes. Insurance. Got it.
Somebody checked it to make sure it all checks out. That does not mean that all peer-reviewed stuff is great. The studies that came out about autism linked with vaccine, those were peer-reviewed. Turns out that guy kind of mushed his data, but it is a little bit more of an insurance that it's more accurate.
It's something we can hang our hats on rather than otherwise. Okay.
Yes.
Amelia, studies like these, though, I mean, when they're coming with conclusions, though, or particular bits of data, it's usually phrased in very specific ways, right? Like reflecting the nuances of the data collected, like you said, the sample size. And it seems to me like sometimes things will get noticed, seen, and then grabbed and then generalized, right? Or taken into a different, put in a different context. And then that becomes the data soundbite that spreads as opposed to the data that's in the rigorously researched and peer-reviewed publication.
So like cherry picked and kind of like what happened with the Estes and Wiener thing, like that.
Exactly.
It had its own problems, but it specifically said, at risk, and then it was smushed into something else.
And that's why I think whenever we hear something that says trafficking victims are blank, we should always question it. We want to know where, when, sample size, all that kind of stuff. And again, with going back into the research side, what we're looking for in studies is that they are reliable, meaning that somebody else who went and asked the next group of 250 cisgendered people involved in sex work in Baltimore would come up with the same stuff. So we want to know that it can be proved over and over again and that it's valid. So what we think we're measuring is actually what we're measuring. And you can see here they have a whole bunch of stats. They have a p-value, which looks into whether something is statistically significant, which is a whole other, I won't murder anyone with stat stuff, but this is a good study. It's an example of something that you can use that's specific and reliable and valid. So let's go into this other one. Here's the 72-hour myth. So, and this actually came from the US DHHS actually said this, that children, both boys and girls, are solicited for sex on average within 72 hours of being on the street. It gets worse. The National Center for Homeless Education shortened the time window, and they increased the risk by saying as many as 1/3 of teen runaways or throwaway youth will become involved in prostitution within 48 hours of leaving home. My first question for that is like, how would anyone know that? Fox News Milwaukee recently sensationalized the story for an audience by increasing the number of victims to say that 90% of runaways became involved in prostitution within 48 hours of running away from home. Now, the problem with this is that there is a really big connection between kids who run away or kids that have unstable housing and kids that are at risk of trafficking. Nobody is trying to deny that that is a major risk factor, and that's actually something we have to look at. The problem is that when we say things that aren't true, people stop believing us, and we lose our credibility. So when you dig into this, there was actually a whole study on this where they tried to find the source for this, and it basically came up the same thing as the average age is 12. They couldn't find anything good, and the researcher said it's impossible to find any credible source for this claim.
It's so interesting, really. It's like a game of telephone. You know what I mean? Like some little bit of data surfaces, legitimate source or not, right? Somewhere. And then it keeps getting picked and slightly tweaked and picked and slightly tweaked. And before you know it, you have what might have been a claim that arose from something that, was something research based. And now it's, so wildly beyond, but you can trace the path.
Yeah.
And I also think just the interest in getting it out there can sometimes fall victim to that. Like, I can't find the data, but people need to know this.
Mm-hmm.
You know what I mean? Like the opposite way. And that, to me, I get it. But at the same time, it is reckless.
Yeah. And the part that bothers me the most is that there is this really big risk factor for kids that are homeless. And I don't want that ignored. I just want it explained in an appropriate way. And the other thing that's crazy is that there is good research on that. So, for example, there was a Covenant House International study that they partnered with some researchers. So, Covenant House runs some of the biggest homeless youth shelters in the US and actually in other countries. And they did a 10-city study on labor and sex trafficking among homeless youth. So they had 641 homeless residents of their shelters. And unsurprisingly, they found that there is indeed real reason to be concerned about both sex and labor trafficking of homeless youth. But there remains no evidence to support these exaggerated claims. And among the homeless and runaway youth that were ages 18 to 24 that they surveyed, they found that 19 to 20% of them had been trafficked. And 91% of that 19% reported that strangers had approached them when they were homeless, offering them suspiciously lucrative job offers. They were approached on the street, at bus stops, at train stations, on social media. They were approached outside homeless shelters. They were offered jobs, selling stolen goods, or working in landscaping, or getting involved in pornography. So the problem that some of these exaggerated claims are pointing to is correct. There are kids that are homeless people are actively trying to exploit them. But when we use stats that just have no basis in reality, I think it actually ends up distracting from the real issue. So one thing I think we can always say is that put it in softer terms. Youth who are homeless are put at increased risk of being trafficked. We do know that that's true. You don't have to say what percentage, but you could say a statement like that is supported reasonably by the research, and then you could give an example. So this one, for example, 2018 study showed this pretty large percent of victims of homeless youth were victims of sex trafficking. And then, of course, we're going to give our citation here so that people can check if they want to read it themselves.
And I said that we were going to get to this at the end of the presentation, but it's kind of perfect timing. Brianna asked in the chat, okay, so this all stinks. How can we bring awareness to this issue, which we know is real, despite the fact that so many data sources online are not accurate? And I think that you hit on it. We get asked that all the time. We were asked that within the last week, Heather, on something that we did. And I do exactly what Amelia does. Whereas I say, I am honest about the fact that we went decades with really bad data. And at this point, we are in the process of obtaining better data. But what I talk about and what we talk about is risk and vulnerability and the things that we know put people at increased risk of being trafficked, right? And so we know that being unhoused or unstably housed puts people at increased risk. We know that just being young and dumb puts people at increased risk. We know that youth involved in the family policing system are put at increased risk because they have less likelihood of having adults modeling responsible behavior. We know that, the criminalization of prostitution and drug use put people at greater risk because they get arrested, because they have to live their lives in the margins. We know that people who are transgender are put at higher risk because of the discrimination and abuse and violence that they face, that then forces them into the margins where they have, they are probably going to meet someone who doesn't have their best interests at heart. And so that is the way that I answer the question. I do give a nod to the craptastic data from before. I do talk about the fact that it's getting better, but I say that we need to talk about vulnerability and we need to talk about risk. And we talk about being put at increased risk because, again, it's not the person, their being that puts them at risk, right? It is the reaction to them, right? So it's not being homeless, it is the challenges associated with homeless and the systemic lack of support that people who are unhoused have that put them at greater risk, right? Being Black doesn't put you at risk. Racism puts you at risk, right? So it's important to kind of couch things in that way. I think Renee just said, like, this is our experience. Yeah, absolutely.
Renee was commenting earlier too about, like, you know, and Amelia, you said this as well. There are some places you can go for data. I think it's just important what you do with it. You know, like Renee was mentioning participating and how their data sorting with an FBI program that I think, Renee, I'm not sure exactly what was going on with that, but Operation Cross Country, where I'm assuming they were, you know, tracking youth and adult victims that might have been transported, you know, to other states. Like those are, you know, some hard reported data points. Again, just giving them the right context, right? Where did it come from? What was being tracked? You know, who was doing the tracking? Like then you can, as needed, like reach for specific data points. I think what the problem is, what I'm hearing from Amelia and what we see all the time is just this, you take it and you generalize it in the wrong way, right? In a way that makes it maybe a little bit nicer of a soundbite, but
makes
more
it sexier.
Yeah, a nicer soundbite, but more opaque in terms of the origin. You know, the where did this originate? Who was this really looking at? You know, again, that 300,000, even you know, tracing that back 30 years and then finding out it wasn't even just the United States looking across data from 3 countries. You know what I mean? The miscontextualization just snowballs.
And I see Renee's comment here because I know Renee has been involved in many FBI Operation Cross Country, and I apologize if I got that wrong. I don't know what exactly the data points were that they reported on from FBI Cross Country. I'm not sure, Renee, if you could tell us if they separated out like people who were definitely trafficking victims from people who were involved in the recovery at some point. I think that's where I got.
Or if the media says it, because the way it's reported is that we recovered this many people, we arrested this many traffickers, and that is simply not accurate. But we don't have to debate that particular stat because I know you have more information to share with us.
And there's been multiple stats that have been attributed to the FBI, and when the FBI is asked, they're like, we never put that out there. So people sometimes just like attribute things to sources that sound credible, and even if those sources are not putting out that information. I do want to also just think about the crimes that we're dealing with in context. So often I am working in like the child welfare field, and I feel very passionately about helping victims of trafficking. I think experiences of trafficking are some of the worst things that somebody could experience. And trafficking is what happens when every other social safety net fails. But I do like to keep it in perspective. So in 2021, sex trafficking of children accounted for 0.1% of all the maltreatment reported to Child Protective Services in the US. We are talking about a tiny fraction of kids that are experiencing this. It doesn't mean that it's not horrible. It doesn't mean that I don't care, but I do like to remember when I'm asking for resources that there is, you know, all these other like tens of thousands of kids that have experienced physical abuse, neglect, sexual abuse. And so I just like to kind of try to keep perspective. That likely is an undercount. But the other thing that I think we can make the case of is that even if the numbers are low, and this is where I've made a case, especially to people who are in charge of money, is that these are trafficking victims are expensive in that they are high utilization users of a system. They show up in emergency rooms. They are often sometimes put into institutions that cost hundreds of thousands a year. They keep showing up to the ER. They have long-term chronic health conditions that in a cost-benefit analysis would be very expensive. They've experienced significant trauma. They're in and out of homeless shelters. It takes a lot of resources to then come around those kids. The crimes are very severe. So even sometimes if the numbers are not as high as other types of maltreatment, the repercussions and the trauma and the resources needed to respond are big.
I just want to interrupt again for people listening. I know it's 1:05. We will probably go till close to 1:30. This is being recorded. So if you have to drop off, don't worry. You can always watch the last half another time.
All right, let's practice. So let's practice summarizing and citing a statistic so that it's accurate and helpful. Let's say we do want to talk about how many child sex trafficking victims there are in the US. We already know that this is a very daunting task, but let's try to do it anyway. Let's go to a reputable source. So let's go to this government report. So this is put out by the Department of Health and Human Services Children's Bureau, and it's recent. 2021. So this is going to talk about data from 2020. And let's see what they have. So we go there, we read all the stuff. No, we don't read the whole 300-page report, but we do go to the tables, which you can see right here. And you can see that sex trafficking is a type of maltreatment. And this is the number of victims that were reported. Take a small note, Maryland did not turn any numbers. Don't know why. We're going to work on that. And you can see down here that there was a national total of just about over 1,000 kids. So we can say there's 1,086 victims of trafficking. No, we can't say that. That's not right. We can make it better. I mean, that is true in its context, but we need to add some stuff. So then we're going to add in the United States, there's over 1,000 victims of trafficking because we're just talking about the US and we don't know who else is going to look at this. Then we're going to add a citation so people know where we got it, including the web address so people can go look at it themselves. This is me in the corner reminding you to put your citations in. But it's still not great. We need to add where the information came from. 35 states reported a total of over 1,000 victims of sex trafficking. We need to clarify because it wasn't sex and labor. And I put in the date. So now people know like who reported, what geography, what type of trafficking we're talking about. And the 35 states tell people that, there was still 15 states that didn't report. So that number is likely an undercount. And then I still have one more thing to add. Okay, age 24 and under, because they were not surveying, they were not looking for, not accepting reports of anyone under the age of 24. So yes, this is a more longer, less like soundbitey stat, but at least you can feel really good about the information that you put up there. So if I was going to do a presentation, this is what I would include with all those details. See how we went from like not so good to really good? It just involves including some context. So here are some tips for you all at home. So check your work, set a good evidence-based example, make sure that every training and presentation that comes out of your shop always has citations and reference lists that are available for the participants. Make sure your staff are not just saying things that they think are true. They actually have to have some information to back them up. Be specific, just like we did in that practice scenario. Instead of saying hundreds of thousands of kids are trafficked each year, tell kids in 2019, Maryland identified blank blank youth as victims of trafficking according to blank blank source. So be specific. Question everything. As you guys saw, even some of the good sources, University of Pennsylvania, DHHS, ended up with some pretty wonky numbers. So question everything. Don't just accept what people tell you and go read the original research for yourself. And if you need help evaluating if it's a good source, ask somebody. We're here. We can help you with that as well.
I think this is really good. This question everything. I tell people in trainings, like, honestly, start from the assumption that you don't believe it because it might, I don't mean to be cynical, but start from the perception, okay, I need more information to even believe this information. And it's kind of like what we do with any kind of legislative stuff. We think first about all the disasters that could unfold before we think about the good it can do. And it just helps us kind of double back and always have that be your first instinct, because then you're going to go and do those things. Check your work, be specific.
Definitely. And institute agency changes. So come up with a sustainable way for your agency, your task force to stay up to date on the latest research. Two ways that you can do this. We do like a journal club kind of thing. So you can assign like once a month, you're going to look at a new piece of research that's come out and everybody reads it together. And you spend half an hour discussing it. One thing that we do at PARI is that Neil and Brianna and I keep a kind of ongoing updated list of stats that we like written out in the very kind of way that we would share them with citations, so that, and they're categorized by, you know, trafficking in Maryland, trafficking in the US, trafficking and homelessness, so that if we need a stat for something, we can just go and pull it. It already has the footnote right there.
That makes my like nerdy anal retentive heart so happy.
It makes mine too. And then acknowledge the uncone, as I spelled it, the unknown. Just say what we don't know. Don't guess or avoid generalizations. Remember, we can never see the entire population, but you can always report on what your organization does see. Like, we served 25 trafficking victims last year, or I personally have worked with 15, or whatever. You can also speak from your experience as well.
And I think we shouldn't be afraid to do that. Like, even on social media, you know, when you see some of these numbers that now we've unpacked for you floating around, like, I mean, of course you can engage or not engage. Like, I don't engage really in social media, but if you want to, like, sharing that, you know, we don't know, a lot of these numbers are wrong. You know what I mean? Even in conversation with people, if the issue of, you know, anti-trafficking work or trafficking situations comes up, like, we can help demystify this and, you know, hopefully like tamp down some of the rumors and some of the sensationalism that occurs. That's
yeah. And I also think the hardest thing with trafficking is that we don't actually know if we want the numbers to go up or down. Hear me out on this. Okay, so for the reports to CPS in Maryland, we saw them going up. I have no way of knowing. I suspect it's not true, but I don't think that's an increase in child trafficking in Maryland. I think that's a result of all the training and awareness we were. So now, if the numbers start going down, I actually really don't know if I want them to go down or not. I don't know if that means that it's happening less or if people are just reporting it less. And that's a whole other conversation we could go with. But
these nuances are critical. I mean, this is what leads
Yeah.
to deeper understanding and deeper discussions, right? Like, so that, you know, like you said, like that's a huge causal thing, right? Like, is it the training? Is it the awareness being raised that's leading to more reporting? That's different than, you know, skyrocketing of abuse, you know, and exploitation.
Yeah.
So,
Well, that's my biggest pet peeve with the way that those heat maps from Polaris are used. They are used as evidence of trafficking. And so you see these huge red balloons around like Baltimore, New York, etc. I have no doubt that there are more humans in the area than maybe in a certain other state on kind of the left-hand side of the country. But I also know that there are vulnerabilities everywhere. And so be very careful about using that heat map and say, look, we are a hotspot or a hub of trafficking, because all that is recorded tips. And so if your task force is doing a fantastic job and is very accurate, right, you're going to have more people seeing something and saying something, but you may not be doing a great job at what people are reporting, and so it might not be trafficking. And so it's really, it sounds good to say our town, our city, our state is a hotspot for trafficking. Well, the reality is, anywhere where there's poverty, anywhere where there's struggles with substance use disorders, anywhere where there is extreme wealth, you know, there's trafficking where there's vulnerability. And I think we have to be a lot more responsible about the way that we portray the places that we live and the reasons why numbers or data looks so high. You know, those heat maps are not data. Well, they are, but they're not data on trafficking.
And there's also, I mean, there's reports of trafficking where there's Facebook rumors. You know what I mean? Like, there's also like that's another issue I have with like the heat maps, because I do feel in the last few years, particularly as certain rumors on social media from certain sources have gotten more play, gotten amplified by certain groups. It leads to more like false flags in a way too. That's not helping with data gathering or understanding what this problem truly looks like.
Now, on the inverse, Amelia, what would you say so sometimes I will say something like that and I'll get someone who says, yeah, but isn't it better if they know something's going on? I'm not saying it as effectively. Like, do you know what I'm talking about, Heather? So somebody will say, well, isn't it better that they know something?
Yeah, better
than nothing.
Better to say something than say nothing, right? If you suspect. It's just, again, I think this speaks to an issue where there's just such a lack of understanding of the many factors that can put someone in a place of being more vulnerable to being trafficked versus very superficial like indicators, like a white van is driving around Target. You know what I mean? Or
yes. This makes me think about
there was a t-shirt on your windshield at the mall.
Oh yeah. I mean, this makes me think about, like, let's say we have a finite set of resources. Let's say we have $100,000 and we can try to work on preventing trafficking. We could try to, let's say we wanted to do one presentation in every school in Maryland. We could do that. Not all kids are at somewhat of an elevated risk because of their age, but not all kids are particularly at risk for trafficking. Or we could try to take that money and do a more focused approach towards people who are experiencing vulnerabilities that really do put them at trafficking. Maybe then we're able to do 5 presentations at youth homeless shelters or in group homes or in foster homes. We're able to like really target to use the best of our resources. I'm not going to argue with someone that says like every kid is at risk for trafficking. I do think young age makes you more vulnerable.
That's more of a generalizable area. But
yeah, but some kids are way more vulnerable than others. And I don't know that it makes a whole lot of sense to try to go to every 3rd grader in Maryland and tell them don't get trafficked using this curriculum. I think if we're just like back to the HIV and AIDS epidemic, let's look at who is really carrying the burden of this crime and let's help them.
Let's help them and let's focus on those similarities in other areas and other populations and make them more aware.
Yeah, absolutely. And with that, that's actually all I got. So if there's questions, I can take those.
Thank you so much, Amelia. This was such a great unpacking of, I really appreciate you doing some of these like very commonly thrown around numbers and statistics, because I think we've all encountered them in our advocacy work.
I've spread them. I'll admit it.
Yeah, I have.
Early days.
Yep.
I take the blame.
Definitely. Well, again, I think we're all looking for a way to make this relatable, to make it easily digestible. And sometimes that means you lose nuance, right? And you lose
to make people care.
Yeah, and to make people care. And that's a struggle we all have as we're doing advocacy around this issue. So this was really helpful. Thank you so much. Any questions, please feel free to use the chat. I think did something just come through on the Q&A, John?
Yeah.
I just said me too.
Okay.
And how is the data in school systems captured? In the wealthier counties, it exists, but it is labeled as missing kids. Or if we say it doesn't happen, surely that means it actually doesn't happen.
How is the data in school systems captured? So I guess, the data on trafficking would be how many, one way to measure that would be just how many mandated reports are teachers and school staff making about trafficking to their local department. For me, that stands out as probably like the number one data point that you could measure.
Which we couldn't do before sex trafficking, and sex trafficking wasn't listed as a form of abuse. And I will tell you that labor trafficking for minors is not listed as a form of abuse. And the task force, one of, I think actually our only kind of primary bill this year, this legislative session, is on adding labor trafficking to the kind of mandated reporting statute, because you have no idea if at this point in time, if school folks or counselors or whatever are calling in mandated reports about labor trafficking. They have to call in something else because labor trafficking is not a code that they can use. And while you finish, I'm just going to find that bill number so folks can look at it.
Yeah. And DHS is very supportive of that, of adding a category into the what's called a sequence data system. And that will mean that us as their partners can do the same type of analysis and data monitoring that we do for sex trafficking. We'll be able to do it for labor trafficking as well.
Amelia, I think my closing question is just, do you have any recommendations for places that people should look to or could look to for good data points here in Maryland? I know it's a tricky one, and you can also think about it, and we can always send out information to participants.
Well, one thing I like that I've seen that actually is really good. I use the Uniform Crime Report in Maryland, which is buried really deep in a Maryland State Police website, but I found some great information on and the numbers of kids under 18 who are arrested for prostitution every year. And I'm very happy to report that in the most recent Unified Crime Report, they were 0, which is a really big improvement from 10 years ago. So crime stats like that are helpful. We often, we're waiting to do some more analysis, but we're going to share like a 10-year report on child welfare data. The National Human Trafficking Resource Center has, and actually I do think they're doing a better job. They break their numbers now into like signals, which is like anyone calling about anything. And then they have a higher definition, a tighter definition for cases and number of victims. So make sure you see like which level of that you're using. And as a task force, let's start to share more publications that are being made, and make sure people have access to journal articles, because they are expensive. And I probably shouldn't say this because it's being recorded, but if you have something, you don't have access to it, come find me and let me see if I can help you.
Amelia, not that I want to volunteer you for anything, but it would be nice if we had a data subcommittee who compile, because I'm thinking that's a good thing to be housed at a university that has access to stuff that the rest of us don't. And then maybe an intern whose job it is to cull all of that and make that available somehow to us.
Or it could even be that task force members go to if they want to use data and they have some questions about how they're framing it, or you know what I mean, like, so that we can really try to be as accurate as we can here in Maryland, and not conflate things or sensationalize in ways we shouldn't be.
I think the last thing that I want to say about sensationalized data is, I know that one thing we are all committed to is access to justice for victims, whatever said justice looks like for them, right? And when we perpetuate these myths using bad data, right, we are uniquely and concretely impacting victims' access to justice, right? Because what we say matters, our words matter. What we put out in public is what potential jurors see, is what prosecutors see, is what judges see. It's what we see, right? And so it's not even that it's just bad practice to do this, which it is. But the picture that you paint about the issue is what people know about the issue. And so when you have a labor trafficking case where no one's ever even heard of that, because that's not what our organizations are putting out there, or when we don't talk about the trafficking of LGBTQIA folks, or when we don't talk about adult trafficking, when we don't talk about anything but pimp controlled trafficking, you are setting the stage for what people are going to understand as being trafficking. And when people attempt to access services or access justice in some way, that is a part of the analysis of whether or not they are the right kind of victim. And I think that we can take a lot of, not comfort, but guidance from, you mentioned the HIV movement with data, but as far as the picture that's painted, when the DV movement began, they had to do something very similar. They had to take a crime that was in the home and somehow get it out and get people to care about it. And so they painted the picture of a victim who was cisgender, white, passive, with straight, and with obvious physical bruises and things like that. And that problem of that kind of perfect victim, that myth of the perfect victim that we talk about all the time, perpetuates itself to this day, right? And we have not done any better in the anti-trafficking movement. And the data that we put into the universe plays a very big role in that.
Totally. Yeah. Share nuance. Scream it from the rooftops.
Share context and nuance.
All right. Well, thank you so much, everyone, for joining us today. Thank you so much, Amelia, for a great presentation.
Yeah, absolutely.
We really appreciate having you on. This is an important topic that I know we'll be continuing to revisit. To everyone listening, please be thoughtful when you share statistics or information about this issue we're also passionate about. As you know, this is part of our quarterly webinar series through the Human Trafficking Prevention Project, working in partnership with MVLS. If you need any more information about this project, please feel free to reach out to us. We actually have our old outreach materials here. Jess has some great new ones in a beautiful teal color scheme that are available. And you can go visit her new website, htprevention.org, or send an email if you'd like to get some more information. I'm having trouble. There we go. We sometimes flipping between Zoom and the PowerPoint takes a minute for my poor, slow old computer. We do have a bunch of trainings upcoming through MVLS as well as the HTPP. Here at MVLS, we're going to be continuing our discussion of the changes to expungement law that have happened in the last year. So we hope you'll join us for discussion about the Redeem Act, part 2 of our training, which will be happening on February 15th. And then on May 16th, looking pretty far ahead, it's previewing. We don't even have a registration form up yet. We will be talking about name and gender marker change in Maryland. There have been some changes. I'll be joined by one of our fantastic MVLS volunteers who's done dozens upon dozens of name change cases, and we'll be talking about what the process is here in Maryland, how we can protect survivors or anyone's privacy and safety. So looking forward to that. And we have tons of webinars that you can go view from this series and from MVLS as well. You can go to MVLS's HT resources page to get some more information about that. We do have a post-webinar survey that we hope you will take when you exit out of this program. It should pop up on your browser, so please take a minute for that if you have a chance. And then again, just a huge thank you. We will send out everyone's contact information so you can follow up with questions for Amelia, for Jess, and myself. We are really appreciative of everyone's time today. To learn more about Amelia's work at University of Maryland, here's her email. Same with learning more about the Human Trafficking Prevention Project. If you are a volunteer attorney who is listening in on this session and you're interested in taking some cases through the HTPP at MVLS, please feel free to reach out to me directly. Otherwise, thanks so much and enjoy the rest of your Thursday.
Thanks, everybody.
Heather, real quick, just so I can do for our reporting, how many people did we have on at the height of it? Do you know?
You're recording, by the way.
Oh, sorry.
No worries. People are, I think, writing down some information and they'll jump off. We had about 30 people.
Cool. Awesome. Thanks, everybody.
Yeah.